Namaste and welcome to yet another Facebook Live session. Today's focus is on the topic gallbladder and biliary tract disorders. And we're very happy to have with us Dr. Santosh Anand, Senior Consultant Surgical Gastroenterology and Minimally Invasive GI and HPV Surgery, Apollo Hospitals, Greams Road, Chennai. Dr. Santosh, with his wealth of expertise and experience, is here to address all your queries regarding this significant health issue. A very warm welcome to our Facebook Live session, Doctor.
Thank you, madam.
To begin with, Doctor, what is the gallbladder and what are biliary tract disorders?
So, what all we eat, it goes through the food pipe, it enters the stomach, and then it enters the small intestine. So, in order to facilitate digestion of the food which we take in, two organs are there in the body which secrete certain enzymes. One is the liver, which is present in the right side of our upper tummy or abdomen, and another thing is pancreas. Now, a tube called as bile duct carries the bile secreted from the liver to the intestine. So, right side liver has got right bile duct, left side liver has got left bile duct, both joined to form a common bile duct. And the gallbladder is a small outpouching from this common bile duct, the basic function of which is to store, concentrate and secrete bile whenever it is necessary. See, we have food only some 3 times a day major food and twice snack something, and bile is being secreted by the liver all the time. So, in order to store it, gallbladder functions in those periods bile is not actually required in the intestine. So, biliary tract carries bile from the liver, gallbladder is a small outpouching from this biliary tract.
And what are the common symptoms indicating a gallbladder or a biliary tract disorder, Doctor?
So, the most common disorder of gallbladder or biliary tract is the gallstone. So, the gallstone, if it blocks the gallbladder alone, it can cause something called as biliary colic. What we will perceive is after having a good fatty meal, when bile is required, the gallbladder will contract, but it will be blocked by a stone. So there will be pain in the right side of our upper abdomen, which may sometimes radiate to the back. Or if it is severe, causing infection of the gallbladder, patient may develop pain which lasts for a longer period. Usually, if it is not infection, it lasts only for a very short period. But if it turns out to be an infection, it lasts for 6 hours, 12 hours or so. So this is the most common symptom. The other common symptom is dyspepsia, or even after having a small amount of fatty meal, we will start feeling bloating in our upper abdomen. These are the most common symptoms of the biliary tract disorders.
So, how do we differentiate as a layman, Doctor? How do we differentiate between a normal stomach pain or maybe even a symptom related to these disorders? How do we differentiate it?
So, upper abdominal pain, which we get most commonly in gallbladder, is usually towards the right side of the upper abdomen, as I said, and it can radiate to the back. The other commonest condition which causes upper abdomen pain is something related to acidity or ulcers. It usually happens in the middle portion, and rarely it can go to the left side of the abdomen also. Pancreatitis, the other condition which causes pain in the upper abdomen, usually radiates to the mid back. So these are the subtle differences with which we can differentiate between gallbladder pain and the other pain.
And what are the likely complications that are associated with the gallstones that you had mentioned or the biliary tract infection that you had mentioned?
So, gallbladder stones, as I said already, if it blocks for a prolonged period of time, it can cause infection of gallbladder, leading to a condition called as cholecystitis. So, cholecystis gallbladder, itis is infection. So, that can, in some patients who are diabetics or those who have some comorbidities, sometimes it can rupture and can cause localized collection of infected fluid or the pus. The other common complications include the migration of the gallstone from the gallbladder into the bile duct. It can obstruct the bile duct so that bile from the liver is not going to enter into the intestine. It spills over into the blood, causing what is called as jaundice. The third most common complication is the stone blocking not only the bile duct. The bile duct, before entering the intestine, joins with the small tube from the pancreas, which is called as a pancreatic duct, to form a common channel to enter into the intestine. If the stones block this common portion, which is both bile duct and pancreatic duct, it can cause a severe condition called as pancreatitis.
So, how do these disorders, the gallbladder or the biliary tract disorder, how do they impact health in the longer run, Doctor?
Okay. So, with the advancement in preventive health checks or master health checkup, we do identify gallbladder stones even before some of them develop symptoms. So, an asymptomatic patient with gallbladder stone, for them to develop symptom, the chances is 2% per year. So only 2 out of 100 will develop symptoms. But whereas a person who has already developed one of those symptoms, which I have elaborated in the beginning of the interview, those who already developed, the chances of them developing recurrent symptoms or symptoms again, it increases to 20%. 1 in 5 may develop symptoms. So this can be reflected into affecting their day-to-day life activities. If certain complications like jaundice and pancreatitis occurs, patient will definitely require hospital stay. At times, it can be very, very significant, causing mortality of nearly 2% in severe acute pancreatitis and requirement of ICU stay for a prolonged period of time also.
Can biliary tract disorders solely cause jaundice that you had mentioned, or are there any other underlying conditions, doctor, that can lead to this symptom?
So jaundice is a symptom. It is not a disease condition. For example, dengue is a disease condition, fever is a symptom. Something similar to that, fever can be caused by innumerable number of conditions. Likewise, jaundice can also be caused by innumerable number of conditions. Gallbladder stones and biliary tract disorders are one among them.
One among them. And how do we diagnose these disorders so accurately at Apollo Chennai?
So initially, one who has suspicion of jaundice or suspicion of gallbladder stone, basically we can do an ultrasound scan. So which is very good in picking up gallbladder stones, but they are not very good in picking up stones in the bile duct or pancreatic duct. So not all who have gallbladder stones will have bile duct or pancreatic duct stones. So for them, we will do some then blood investigations, which will give us an idea, raising suspicion that okay, they can have some complications of gallstones. In those patients, select group of patients, we do an advanced scan called as MRCP or magnetic resonance cholangiopancreatogram. It's an MRI scan with special focus on the bile duct and pancreatic duct. So these three tests, ultrasound scan, MRCP and blood test, will definitely pick up almost 99% of all gallbladder and biliary tract disorders.
Are there any risk factors, doctors, that make some individuals more prone to these disorders?
So gallbladder stone per se is very common in female. So women are at 8 times more risk when compared to men to develop a gallbladder stone. This is because
Why
of
so?
their hormone progesterone. So particularly the progesterone levels will be more peaking at the time of pregnancy. So we do see quite a lot of female post pregnancy or post delivery presenting to us with symptoms related to gallbladder stones. So the other risk factors include fatty food, decreased physical activities, and high cholesterol diet. So diabetes and associated comorbidities will make the symptoms very significant. For example, a non-diabetic patient developing a symptom may not go in for a complication, whereas a diabetic patient, if he develops a cholecystitis or inflammation of gallbladder, the chances of the gallbladder rupture is more in these patients.
So, what are the treatment options available today, doctor, to treat gallstones or biliary tract issues?
So gallstones, if they are symptomatic or the size is more than 1 centimeter, even though if they are asymptomatic, or the patient is having an underlying diabetes, harboring stone which is more than 1 centimeter for a longer period of time, or the stone is growing in size. So I elaborated some 4-5 conditions. So for them, the treatment is a laparoscopic removal of a gallbladder. So the thing is, we just don't remove the stones alone. We remove the gallbladder completely for 2 reasons. One, if we remove stones alone, stones will form back 100%. The second thing, one of the functions of gallbladder is to prevent formation of stones. So whenever stone forms in the gallbladder, it means that the gallbladder is not functioning properly. So the storage function of gallbladder would have been slowly taken over by the liver itself over a period of time when the gallbladder stones are getting formed inside. Now in complications like bile duct stones or pancreatic duct stones, so they will require in-hospital stay. Bile duct stones can be successfully removed by an endoscopic procedure called as ERCP. At times, big stones, multiple stones which are not easily removed by ERCP, surgical procedure like we can open the bile duct and remove the bile duct stones also.
Are there any risks associated with these surgical procedures, doctor?
So when compared to previous era, the surgical expertise in gallstone or gallbladder surgeries have improved a lot. But even though the chances of bile duct injury, for example, we are removing gallbladder, the chances of injury to the bile duct is to the tune of around 1% if it is done in non-expert hands. So that will definitely increase morbidity in a patient, which is called as bile duct injury. And that may lead to multiple procedures, at times requiring repeated surgeries also.
Doctor, you mentioned about recurrence of gallstones. Is there a chance of recurrence of gallstones or biliary tract problems even after the treatment?
So gallbladder stones, if we had removed the gallbladder completely, the chances of formation of gallstone is nil. But there are certain conditions in which if the gallbladder has inflamed or got infected so much that at the time of surgery, if we tend to remove the gallbladder completely, the chances of injury to the adjacent structures are more. So what we do is we remove 90% of the gallbladder, leaving 10% of the gallbladder inside so that avoid unnecessary injury to the adjacent structures. So in them, recurrent gallstones can form. And again, primary bile duct stones. So certain stones can form in the bile duct per se, which are not originating from the gallbladder. So they can develop due to certain reasons like our ethnic origin. Southeast Asia is more prone to develop primary bile duct stones. Infection due to certain worms like ascariasis can cause bile duct stones per se, and rare conditions called as recurrent pyogenic cholangitis and biliary strictures, a congenital condition called as choledochal cyst. It's like a cystic dilatation of the entire bile duct. The normal contraction of the bile duct goes in this, so there is stasis of bile within that cyst, and stones can form in these.
Doctor, can these disorders affect other organs or bodily functions?
Per se, they don't affect, but complications like jaundice and pancreatitis can lead to a severe condition called as sepsis or SIRS. Whenever patient goes in for sepsis, septic shock or SIRS, each and every organ of the body can be affected. To be particular, acute severe pancreatitis can happen 1 in 5 patients. So those patients, all organs like respiratory system, lungs, heart, kidney, liver, clotting mechanism, everything can get affected. Chances is very less, but yes, there is a definitive risk of these organs getting affected if it is complicated.
So, what are the lifestyle changes that as individuals we can make to prevent these kind of disorders, doctor?
We have to reduce the fatty food intake, and whatever we eat, we need to burn. So physical activity should also increase accordingly. So the normal physical activity which we recommend for 60 to 70 kilogram men or women is to have a brisk walk to the tune of 5 kilometers in 45 minutes or 1 hour. So anything equivalent to that, like they can do treadmill, they can do cycling, they can do swimming, they can do jogging, but it should be equivalent to brisk walking, which covers 5 kilometers in 45 minutes. Diabetes should be in control. Having junk foods should be reduced, and not only this, intake of alcohol and smoking should also come down, because alcohol and smoking may not cause gallstones directly, but they increase the risk of biliary tract and pancreatic disorders. So having a good lifestyle, good food, increase physical activities, quit or avoid smoking and alcohol.
We'll take some questions from our viewers, doctor.
Sure.
My family has a history of gallstones. What are the steps that I can take to prevent or lower my risk of developing them? Or will I for sure develop them at any cost?
Usually, it doesn't run in families. It is mostly caused by environmental or associative factors. So, one needs to decrease their fatty food intake, do quite a good amount of physical activity. And if you are a diabetic, keep diabetes in control. So, lessen your cholesterol intake and have a good physical activity. This will reduce the chances of you developing gallstones.
Hello, doctor. I've noticed changes in my bowel movements. Could this be connected to any gallbladder issues? Should I be worried?
Usually, altered bowel habit is not related to gallbladder stones, but it can cause indirectly. For example, one takes fatty food. After taking fatty food, those who harbor gallstones may have certain kind of blotting in the upper abdomen. So we consciously avoid taking fatty food, or after taking fatty food, we will have some altered bowel habits. Only this way, bowel habit alteration can be related to gallstones. Otherwise, there is no direct relation to gallstones and altered bowel habits.
Hi, doctor. I'm overweight and worried about the impact of my weight on the gallbladder. How does increasing weight affect the development of gallstones?
Most of the gallstones which we see are due to cholesterol stones. So one who is obese their body cholesterol is definitely high, which can pave way for formation of gallstones. So it's prudent to decrease weight, come back to ideal weight, and at the same time, weight loss should not be very rapid, because rapid weight loss increases good cholesterol, but at the same time doesn't reduce bad cholesterol quite significantly. So weight loss for more than 1 or 2 kilograms every week is going to be negative. Even that can cause gallstones. At the same time, 0.5 kilogram every week weight loss is good. If you are obese, definitely increase your physical activity, reduce the fatty food intake. That may help to prevent gallbladder stone formation.
I've been on quite some medications for other health issues, doctor. Can these medications potentially cause harm or problems to my gallbladder or biliary tract?
Previously, certain cholesterol lowering drugs were known to cause gallbladder stones, which are withdrawn from the market these days. Very rarely, an injection called as octreotide, which we use for rare conditions like those whose bowel significant length has been cut due to certain conditions, or whose bowel is less not utilized properly. They may be on parenteral nutrition. So octreotide and parenteral nutrition can predispose one to a gallbladder stone. Not other medications, or not quite a lot of medications predispose for gallstone formation.
What would be your message to our viewers today, doctor?
So get yourselves screened for preventive health checks. Identify gallbladder stones at an early stage, because even if you develop simple symptoms, you can get them operated. Or if you have comorbidities like diabetes, stone is big, greater than 1 centimeter, or serially the stone size is increasing, you can get yourselves removed from the gallbladder. And this surgery, an elective removal of gallbladder, it's just going to cost you 1 day in hospital and maximum 1 week of rest. But if this complicates, the hospital stay will become 2 to 3 days. If it goes in for pancreatitis or jaundice, your hospital stay may be in weeks to months also, and that can impact your life after that. So not only that, gallstones for quite a long period, for more than 20 years or so, if our ethnicity is from North India or sub-Himalayan belt, they can rarely cause cancers also. So be yourselves aware of presence of gallstones and take measures to reduce gallstone formation, like healthy food, good in fruits, green leafy vegetables, less fat, good amount of physical activity will definitely help you prevent complications from gallstone formation.
Thank you very much, doctor. That was a very interesting and enlightening session for all of us to understand more about gallstones and biliary tract disorders. Thank you, doctor.
Thank you.
For appointments with Dr. Santosh Anand, Senior Consultant, Surgical Gastroenterology and minimally invasive GI and HPB surgery, Apollo Hospitals, Greams Road, Chennai, please contact 044 4040 1066. I repeat, 044 4040 1066. Thank you very much for your time, doctor. Thank you,
you.
viewers.